Most of us have heard of pink eye, but what is it exactly? In this episode of OCuTALK, Dr. Erica Meltzer will be telling us all about pink eye, the symptoms to look out for, the potential treatment options, and what happens if we do nothing at all. Dr. Meltzer?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Erica Meltzer. Dr. Meltzer, thank you so much for joining us today.
Thank you for having me.
Well, thank you again for joining us. We do appreciate it. We know you're very busy. Before we get into our conversation, Dr. Meltzer, I was kind of hoping that maybe you can introduce yourself to our audience. Let them know a little bit about your background and your specialty.
Sure. My name is Dr. Meltzer. I started practicing in May of 2022 after I graduated SUNY College of Optometry. So it's been a year and a half now. I joined my family practice in Great Neck on Long Island, and then I split my week between there and Manhattan. Mostly primary care, private practice type settings, but some specialties, contact lenses, some specialty dry eye, but very general.
Well, perfect. A fantastic introduction. Again, thank you so much for joining us today, Dr. Meltzer. So for our discussion today, we were hoping that maybe you can talk to us a little bit about conjunctivitis or pink eye. So what is pink eye exactly?
Sure. So pink eye is an infection just like any other type of infection that you can get in the body. It is specifically of the conjunctiva, which is the transparent tissue we have overlaying the white part of our eye, or the sclera. So you can't really see it, but it's overlaying that white part of your eye. And it gets an infection that results in you having those pink eye, gunky, red, watery symptoms. Most cases are viral. It's very rare for an adult, especially to have a bacterial case, but you're just talking about a run-of-the-mill infection.
Well, gotcha. Fantastic information there, Dr. Meltzer. And so what causes what causes pink eye to actually happen?
Sure. So most cases are transmission from respiratory droplets. So especially this time of year, someone coughs, someone sneezes, and that bacteria gets in your eye and kind of makes home in that nice, warm, wet environment that you have going on in your eye. Other cases, just dirty hands touching your eyes, whether it be with makeup brushes, fingertips, sharing any sort of things that touch the eyes. Those are the main forms of transmission. There also are some conjunctivitises that have different components, such as allergy components or even like sexually transmitted components. But for your run-of-the-mill pink eye, you're just looking at dirty hands, dirty mouth, droplets touching the eyes.
Well, thank you very much, Dr. Meltzer. And so what is the most common way people get pink eye?
Sure. I feel like in this day and age, it's like kids bringing it home from school. So I feel like anyone with young kids come home from school, they touch everything, their classmates are sick, whatever they have going on. I feel like that's the most common way adults are getting it right now. I also think that people who wear contact lenses, just because they're touching their eyes so much more than a person who doesn't wear contact lenses, they run the risk of having bacteria on their fingers, that type of thing. Also, I feel like winter months, because people are always coughing and sneezing, you're just generally more prone to get it. But anyone who is sharing items, towels, washcloths, pillowcases, anything that has that human contact to it is a vector for being contagious.
Gotcha. I do understand the kids' things. They come home with everything, so I definitely understand that. But fantastic information, Dr. Meltzer. And so what would be like the signs or symptoms that people should be on the lookout for to know, like, hey, this is probably pink eye, and this is probably something I need to go see Dr. Meltzer for?
Yeah, so you are looking at that crusty eye when you wake up, all of that gunk coming out, usually clear, sometimes yellow or greenish in color, but that crusty eye. Also some redness, more redness than just your average, what you're used to. And most cases are pretty watery. And these are all really symptoms that can be kind of anything. They're really nondescript. There's not one thing that pops up that you're like, oh, this is definitely pink eye. I have to go see the doctor. So my answer is come see us no matter what. Even if you think it's just your regular old pink eye, there could be something else going on there. So it's always worth the visit. It's a quick visit. We'll get you in and out type of thing. but better to know exactly what it is instead of just saying, oh, well, this seems like pink eye, because those symptoms are really nondescript.
And you actually just said it. So some of those symptoms are nondescript. Like so, what? So and they actually do sound like a lot of other like medical or eye conditions that some people may
Yeah.
have. So when should someone see like a medical professional? Like if it gets like to a point where it's pussy, or like how does someone know?
Sure. So even with your most gnarly bacterial conjunctivitis, which is when you wipe your eye, that junk is coming right back in, all of that gooiness, that nasty crustiness. Those are the ones that the second you wipe your eye, it's coming back. That you probably want to throw an antibiotic on. So best to see your eye doctor. But even that case is going to burn itself out on its own with no medication in 2 weeks. So I would say if you feel like your pink eye is lingering longer than 2 weeks and you didn't see a doctor yet, I would definitely go. If you are not getting better or you're getting it really frequently, like people who have recurring conjunctivitis over and over and over again, they get it again 2 weeks later, they get it again a month later. That's a time that I would say, let's see what's going on here. Because for most people, it is just, oh, crap, I got pink eye, and you move on with your life. You shouldn't be getting it over and over and over again. Those are cases, I would say, if any changes in vision whatsoever, if you suddenly are blurry, if you suddenly feel like there's any pain, because pink eye is relatively painless, it's more of a nuisance than anything else. So those types of red flags, I would say, come see us sooner rather than later.
Well, thank you for that information, Dr. Meltzer. And so, what are the risk factors for someone if getting pink eye goes untreated?
Sure. So most of the time, this will burn itself out in that 2 week time period, and there hopefully aren't any risk factors. But if it is lingering, if it's getting worse and not better, you do run the risk of having some cornea involvement, which is when the pink eye has transferred over to the cornea part of the eye. You're going to have a lot more pain in this portion. You also might see some infiltrates, so these white dots that come in over the colored part of the eye, and they can impact your vision, especially if they're right over your pupil where you're seeing through. You also might get a little bit more swelling, a little bit more discomfort, and again, vision changes when it does impact that part of the eye. So if you feel like your pink eye is getting worse before it gets better, or just getting worse continuously, that would be a good time to go to the eye doctor and see if there's something more sinister going on here.
Absolutely. And so now that we know like everything that the symptoms, the signs, and we know about what could happen, like the risk factors, what about the treatment options that are available? What treatment options can we do to help us with this?
Sure. So everyone calls and asks for an antibiotic, and they're so unhappy when I tell them that I'm not going to give them one, because again, like 90% of these cases are viral. I think the number is actually 5% of pink eye is bacterial. In every form of pink eye that's available to you, 5% is bacteria. So I don't want to throw an antibiotic on something that is not going to help, and it's just going to increase antibiotic resistance, which we know is a problem in general. So my treatment options are really just supporting your eye, making it feel as comfortable as possible while this thing runs its course. So for me, that's hygiene always, because you are contagious, and you're contagious to your other eye, but you're also contagious to everyone else around you. So it's washing towel sheets, pillowcases, makeup brushes, anything that touches your eye. It's really great, really basic hand hygiene. Wash your hands, try to avoid touching your face, kind of thing. And it's supportive with stuff like OCuSoft lid wipes that you wash every day. You make sure your lids are super clean. I also love a trick of keeping artificial tears in the fridge, because when you put them in your eye, it feels like a nice cold bath, which is nice when you have all of that infection feeling going on there. Those are probably my mainstays of treatment that I offer people, because again, I don't think putting a drug on it is going to change anything.
Gotcha. Understood. And so now you said earlier that it runs its course, and this is viral. So we don't really know how long someone will have it. But I wanted to ask anyway. How long does pink eye typically last for somebody?
I would say worst case, you'll be dealing with it for 2 weeks, a full 14 days, hopefully 7 to 10 with the right hygiene and the right, again, supportive treatments. We can get you through it a little bit quicker.
And are there any like preventative measures that someone can take to kind of help them against getting pink eye?
Yeah, absolutely. So again, like really good hand hygiene and that avoiding touching your eyes, touching your face kind of thing. Also really good lid hygiene, because a lot of the bacteria around our eyes, bacteria that lives on our eyelashes and that little bit of buildup that people can get, that can get in the eyes and also cause that type of infection. So really good lid scrubs, being good about washing your face really diligently, those kind of things just to have in your everyday routine are always really helpful.
Well, and I actually did want to ask you too, how important do you tell your patients, how important is eyelid hygiene to help not only for preventative pink eye, but other eye conditions?
Oh, everything. Dry eye, blepharitis, pink eye, you name it. Lid hygiene is the most underrated, most important component of your everyday routine. And I think people don't realize when they're washing their face, you have to give special care. And it shouldn't be rough. You shouldn't be losing eyelashes when you scrub your eyes, but you should take the extra 10 seconds to actually rub your eyes and your eyelid area. And again, super mildly, but we do have especially women who wear makeup, you do have that buildup of junk on your eyelashes. That's not going to do you any favors.
Absolutely. And before we ended our conversation today, Dr. Meltzer, was there anything else that you'd like to let our audience know about?
No, I am so thankful. Thank you for having me. If you have any other eye care questions, feel free to shoot me a DM on Instagram. We are SpectaclesGN, or on TikTok, it is Dr. Erica Meltzer. So, yeah.
Well, fantastic. Well, Dr. Meltzer, thank you so much. Everyone, that was Dr. Erica Meltzer. Dr. Meltzer, thank you again for joining us today.
Thank you.